Let's see who we've got.
Light. Let's see. I didn't know I was the only one tonight. I thought like the other night there were like 3 or 4 others. So this is cool. I don't have to fly through as fast. I was having like the last one, we all had like 5 minutes. So I'm going through like 13 slides in rapid fire succession. And it's just, this is going to be better. This is nice.
Yeah, plenty of time.
So you're a counselor here in California? Are you allowed to disclose what high school or no?
Yeah, Alto International School in Silicon Valley.
Oh, cool. That's cool.
All right, it
I
looks
live
like
in
we've got 2
Pasadena.
attendees who have joined us. So I'm going to go ahead and get started.
Sure.
All right, thanks for joining us. Welcome to the Virtual College Exploration for all California students, sponsored by College2Career Fairs and StriveScan. Thanks for joining us, everyone. A few housekeeping announcements before we get started. You can use the Q&A button on your screen to type your questions to our presenters at any time. Your camera and microphone are off, so the presenter and I cannot see or hear you. This is just one of many different sessions happening. Please be sure to check out the full schedule at college2careerfairsconnect.org. This presentation is being recorded and will be available within about a week at the same website, college2careerfairsconnect.org. I will now turn it over to our presenter.
Thank you so much. And thank you folks for tuning in so late. I know it is late. I'm going to share my screen with you. And doing so, we're going to chat about Massachusetts College of Pharmacy and Health Sciences. And, you know, believe it or not, you know, the oldest university in the city of Boston, Massachusetts, it's not MIT, it's not Harvard, it's not BU, it's not BC, it's not Tufts. It's actually the School of Pharmacy and Health Sciences, which was founded nearly about 200 years ago in the city of Boston. And it opened up in 1823. It was the oldest school of pharmacy in the country. At that time, we didn't enroll 7,000 students, and they weren't coming from all 50 states and 74 different countries. It just primarily, I would imagine, in the Boston area. Over time, the university evolved, and I believe if you were to ask me, to be honest with you, I think Harvard Medical School, when they built their campus across the street from us and designed their 6 Harvard hospitals around us, Brigham and Women's, Mass General, Boston's Children's Hospital, Dana-Farber Cancer Institute, Beth Israel Deaconess, and a plethora of others, it really did change the complexion of what was just once a pharmacy school into a complete medical school, now drawing 7,000 students from every different state, from every state in this country and from many countries around the world. And they come to Boston to take advantage of that Harvard medical area. And our majors were unique. What was once a pharmacy school is now pre-med, vet, dental, nursing, medical technology, physical occupational therapy, nutrition, healthcare management, drug and regulatory affairs, nuclear medicine, radiology, radiography, MRI, ultrasound, physician's assistant, medical molecular biology, and a plethora of others. If you look at the left-hand side of your screen there, the way our majors are designed is another huge draw. When you look at nursing, which is very popular, I would have to say when I first came to MCPHS back in 2009, and that was an interesting time because we were going through a difficult time in this country as well. We were going through the recession of 2008 and 2009, and many people lost their jobs. The housing market and auto industry crashed, a lot of turmoil. But a school that before that just focused on, in the medical field, a comprehensive healthcare school, which really just attracted a small percentage of people that were interested in medicine. You know, let's remember there was not a lot of STEM, science, technology, engineering, and math back then in high schools. There weren't biomedical pathway programs. There wasn't Healthcare Occupation Students of America, aka HOSA. There weren't a lot of students taking AP and IB, not as much as they are now, and there wasn't the emphasis in AP and IB biology and chemistry. That all came about after 2009 in a school that really attracted a focused, extremely focused audience that was geared toward health sciences, moved into mainstream America because overnight, the jobs in healthcare rose from a few just to 3 million overnight. And between now and 2029, we're probably looking around 8 million or more. It's the need in life. You can't live without it. You need it. You need healthcare practitioners. And that comes with jobs for everyone involved. You look at dental hygiene, that's a 3-year accelerated 4-year degree program. Students are dental hygienists in 3 years. Think about that. They come out in 3 years. There's not a lot of loss of knowledge from one year to the next because it's fall, spring, and summer, and they get that extra year of income because they're hitting the ground running earlier. They make roughly over 100,000, depending on the market that you're in, between 80 or more. If you get your master's in oral health, which we have here, you're certainly giving Novocaine and those kinds of things, prepping that patient for the dentist and the doctor. So those students are doing extremely well, and they're getting out early, and they're really not seeing a loss of income. They're gaining income, and they're not in debt. Pre-dental to dental hygiene, that's a combined program. That is a 4-year program, and that's for students to earn their dental hygiene degree and then go on to dental school. So you get the best of both worlds, the School of Nursing. As I had said before, when I came here in 2009, pharmacy, physician's assistant, our BSMD, becoming a medical doctor was very popular. Don't get me wrong, they still are. Nursing has risen to the top in the last 4 years, and it is extremely competitive. Here it is a 3-year accelerated 4-year degree program, so students, like in dental hygiene, go to school fall, spring, and summer. That's what's so popular about this major, is the fact that you get out a year earlier, you gain that extra year of income. You're really going through the year, fall, spring, and summer. You do have gap periods and you have holidays and breaks. I don't think you don't, but you're certainly really not confused from one year to the next because you just ended one semester, get a break or so, and you're rolling right into the next. So the knowledge is fresh in your mind. You don't have to do a lot of digging back in the memory bank to pull it out. It's there. And students are armed with that knowledge and ready to roll. Diagnostic medical sonography, MRI, nuclear medicine technology, radiation therapy, and radiography, those two are 3-year, 4-year degree programs. When I say 3-year, 4-year degree programs, I know it means students accomplish a 4-year degree in 3 years. In our School of Pharmacy, it's broken down by how and what area of pharmacy students really want to study. Pharmaceutical sciences is definitely the research side. Those kids are going into big companies to do research, or with the Food and Drug Administration. Pharmacology and toxicology is the side effect of the drug and how that reacts to the human body. Pharmaceutical business is healthcare business, along with healthcare management at the bottom. Those are all 4-year bachelor degree programs. Our doctorate degree of pharmacy, that is a direct entry 6-year program, no bachelor's. Those students that enter that program are graduating right out of high school. They're going straight through to get their doctorate degree, and we're calling them doctors after 6 years. And our 4-year degree programs are biology, public health, healthcare psychology. I'll get to pre-medical health studies in a moment, but chemistry and health sciences. But our pre-med umbrella extends to PA, PT, occupational therapy, optometry, the BSMD, 4 years, BS going into the remaining 4 years MD. It's a dual degree. With that, medical doctor focuses on specific symptoms of the human body. The doctor of osteopathic medicine, they focus on the entire body. And I'd say our DO program, along with nursing, pharmacy, pre-med, and PA, are popular as well. Those students coming out of high school, it's extremely competitive. They apply and they're admitted. They then have an interview. They can choose to have that in their senior year of high school, or they can do that in their first year with us before the year ends. If they pass their interview along with the acceptance letter they got, let's say their senior year, they're not quite with us yet, but they've been admitted, they're coming. That year, if they decide to go through the interview and they pass that interview as a senior in high school, they now get a second acceptance letter, which bypasses the MCAT. Those students don't have to take that MCAT, which is the exam to get into med school. In osteopathic medicine, they bypass that. They get a provisional acceptance letter, maintain a 3.0 and above, and you're done in 8 years, no MCAT. PA is 6 years, PT is 6 years, occupational therapy is 6 years, optometry is 7. Think about this, 155 med schools in the country. There's only 20 optometry programs in the country, and we're one of them. It's a good field to go into. That too is direct entry, 7 years out of high school. Our students are surrounded with faculty who 91% of them hold the highest degree within their discipline. They also have a background in medicine. Many of them are doctors and healthcare practitioners, and they're available to our students before, during, and after class in a 17-to-1 student to faculty ratio, average class size 20 students. Like, you're not going to get lost. You're not going to fall through the cracks. 98% of our students pass their boards, 100% get jobs, 80% go on to med school, vet school, and dental school. And we retain 95% of our students. We don't lose many. That has a lot to do with our faculty mentors. That has a lot to do with our tutoring. That has a lot to do with our peer mentors. That has a lot to do with teaching assistants not teaching classes. They may help out in a lab, but that's as far as that goes. Our professors teach all our classes. They tutor our students. They're meeting with them before, during, and after class. Our focus is on student success and our students becoming healthcare practitioners. IPE is a term we use where there's a lot of collaboration. Somebody came with people knowing that our students do all their internships and research through Harvard Medical School, and they go on to have this great success. They often ask me how competitive it is on campus, and I can understand that. It's not like a Berkeley or an MIT or a Caltech or law school even, where students are competing with each other each and every day, looking over one shoulder, trying to get ahead of the class. It's not like that here. Everybody got into the major that they wanted, so they're helping they all have to work together at some point now while they're going through getting their degree. And when they work, think about it, a nurse in one surgery room, you have a surgeon, you have a nurse, you have an ultrasound technician, you have an anesthesiologist, you have eventually a pharmacist who's going to prescribe the medication given to them from the doctor, and everybody communicates in between. So they're going to have to do it at some point in their life, and we do a very good job of that while you're here, just getting you used to that. And that is the best thing I think that can happen to any healthcare student, just getting right off the bat, falling into the rhythm of doing that. IPE, for example, our healthcare psychology students really counsel, for example, our dental hygiene students or our pre-dental students, or even our pharmacy students that are giving flu shots. Patients can get a little nervous about the unknown. Who likes someone putting their hands in their mouth like a dentist, drilling and sawing, although technology's come a long way and it's not as painful as it used to be. Still, it can be uncomfortable. So it's really important for future dentists and dental hygienists and pharmacists and doctors to understand the psychology of a patient. And that's what our healthcare psychology students do a really good job of, counseling those future doctors and working with them right off the bat. You know, at the end of the day, they're going to be working together again 30 years, 20 years, 15 years from the time they're in school. So we get students used to that right off the bat, and they love it, and it helps out a lot. Sometimes, always working together is always best. The internship experience is incredible in Boston, and I think that's why California is our biggest out-of-state market. I believe that that's why we have students from all over the world and all over the country that come here. They know that they can take our education and come back to their home state or their home country, and they can do very well. Whether you're studying pharmacy here, or you're studying PA or nursing or optometry or occupational therapy or sports medicine, kinesiology, physical therapy, by being able to penetrate the Harvard teaching hospitals, you're going to get experience in your field in areas such as HIV, cancer, diabetes, pediatric oncology, nuclear medicine, ambulatory care, drug and research development, diabetes, pediatric diabetes. That allowed Jamie Wen of the Bay Area to come back. He landed a pediatric oncology rotation at Stanford Medical, turned down a job offer at Kaiser Permanente to take a residency at the University of Washington in Seattle. And I think he's now working in the Seattle area because he likes it up there. It's beautiful, Pacific Northwest, and he loves the city, and that's where he wanted to be. And he could easily leverage his internships and research experience through Harvard Medical with us back on the West Coast very easily. That's not hard to do. It wasn't hard for Jamie, it wasn't hard for Catherine this year, who in her senior year worked with the Boston Children's Hospital with a group of scientists and doctors extracting DNA to find a cure for cancers and seizures. That launched her into her residency this year at the University of Southern California, USC, the Trojans, fight on. That's where she's doing her residency, believe it or not, in pharmacy. She wants to come back to the LA area. When you do research through Harvard Med, and those hospitals are world and internationally, they're not just nationally recognized, but they're internationally recognized. They get a lot of funding from other countries, especially and certainly in the United States government. Don't you know California would love to have you with credentials like that? And they gobble you right up. Kaiser Permanente, all of them. That's why so many students come here, because they can get better opportunities coming back to their home state like California or Texas or Seattle with that kind of a resume. It goes far. Many doors open up to them. Our career success is a result of that. Our students really aren't challenged. They're earning the highest salary in the country because of that. And I do want to stress this. I get that. You have to be financially independent in life and to be secure, and that's understandable. But we do ask you to do this because you want to help people and serve the greater good, because that's a commitment, definitely. So as long as you want to do that, you're serving the greater good, you're rewarded for that financially. Absolutely. And you're on top of the mountain with that. A lot of times I get questions, Alan, I want to study medicine. This is amazing. This is what I want to do, but I'm an artist. I'm a musician. I play esports. I play football. I play hockey. So do our kids. A lot of our PAs, a lot of our future doctors, dentists, nurses, they're artists and musicians, and they have a chance to exercise that here. Our students can minor in art, and they can minor in music, and they can minor in these things through a consortium called the Colleges of the Fenway. We belong to this consortium along with Emmanuel College, Mass Art and Design, Simmons and Wentworth Institute of Technology, and of course, Harvard Medical. And our students can cross-register, take courses. If you're not digging what we're serving in our cafeteria, which doesn't happen often, but in case it happens, go across the street to Harvard Med, go to Wentworth, go to Emmanuel, go to Simmons. You can use their dining facilities. They use ours. We can all share our gyms, and it's a pretty amazing experience. And certainly, we offer something called Fenway Cash, where if you're not satisfied with any of those options, which I've never heard anybody really turn down a good meal at our place or Harvard Med or any one of these colleges, you can go into the, we're in the city of Boston, and a lot, you're looking at 250,000 people who are all under the age of 30. They're all college students. They're from all over the world and all over the country. So don't you know, a lot of these restaurants, I can't say all of them because I don't want to do that, but a lot of them take programs like ours called Fenway Cash. So you can certainly use your Fenway Cash for a meal. Absolutely. Moving on to our dorms, which is always a topic of conversation. Whether you're an undergraduate student or a transfer graduate student, dorming is important, and certainly we have a lot of options for you. We have the traditional style, which is, a typical share a room with another student. Many students, I was okay sharing a bathroom on a floor, but I can understand those that don't, and those that don't have the option to take our suite style housing, which you have your own bathroom in your dorm, along with a kitchen and a living room. You share a room with another student, then two on the other, and in the middle is the living, dining, kitchen, and bathroom area off to the side. So very comfortable. It's really up to you. There's a lot of different options. There's several of them, and never heard a complaint from anybody. And getting back to that, I do want to mention this because we are a healthcare university. I've noticed over the past 14 years, a lot of students have allergic reactions to, say, nuts or granola bars, something where an energy bar can be opened in a lab and that hits the airway, and a student with allergies can easily flare up. That's where we would definitely work with that student, getting them a dorm where they can cook their own food and have the food shipped to our chef who can prepare that for that student the way they need that to prepare. So we're very sensitive and very, student safety is high on our list there. For the first time ever, I never thought I'd say this, but it's right. We're right for doing this. Due to COVID-19 and the coronavirus, a lot of students were unable to get to the SAT or ACT testing sites, so it's optional this year. We are SAT, ACT optional, and I would imagine students who are in the future, I haven't heard word that we're going back to it, so it's quite possible we will remain forever SAT, ACT optional, but we are. If students did take an SAT or an ACT and they want to submit that, by all means, they can, and we'll accept that. But this year we're looking for the common application, which is free to apply, no application fee. We're looking for a high school transcript. I do want to say that biology and chemistry are important. They don't have to be AP or IB. They don't, but you do have to have it. It can be general and basic, that's fine, but it's the foundation for medicine. So make sure you have bio and chem somewhere in there. Essays, the Common App has several different topics. Choose one. Whichever one you choose is fine with us. And then we have a short paragraph on why you want to become a healthcare practitioner. We're really looking for your compassion for people and wanting to help them for sure. Dates to remember: our Early Action 1 deadline of November 1 and Early Action 2 December 1. Typically, early action is not binding. It is here. Our early action is not binding. That means students that apply by November 1 or December 1, let's say everybody's a senior this year, here's back within a week, and then they have till May 1 of 2021 to let us know what your plans are, and we don't interfere, we don't force you to commit. That's your call. You can look at other schools, you can apply to other schools, you can commit to other schools. That's the nice thing about early action. Regular decision, which is too not binding, that is February 1st, and the May 1st candidate reply date is May 1. October 1st, just as a reminder, is the financial aid opens up, so make sure you jump on that. We are a private school, no out-of-state tuition fees. Therefore, if a student does well out here academically and gets a higher scholarship than a student in Boston, which I'll get into in a minute, it's cheaper for a California kid to go here than a Boston student. So the playing field is even Steven. With modern day technology, it's very easy to track the status of your application. I do encourage you to always reach out to us. I do review all the applicants from the West Coast in every state, and I can certainly get an answer to you, probably quicker sometimes than technology, but with technology now, like it this would have been great for my generation, or even when I started in higher ed back in 2006 and 2007. We used to fax a lot of things. I used to have to wait for faxes for transcripts and those kinds of things, open up the mail. Nowadays, everything's electronic, and certainly you have a username and password. You create this account for yourself, and you can track the status of your application. You can look in there and see that, once I make a decision on your application, before it's mailed to you, you'll be able to log in here and see the result. It's amazing, and I'm happy for you. I wish we had that. You can see I'm not bitter. Joking. Scholarships are abundant. We offer a lot of them, and they range from 8,000 to 16,000, and they're all renewable each and every year as long as you maintain a 2.5 GPA. Whether you're in a 6-year doctorate degree PharmD program with us, or a 3-year accelerated nursing degree, or a 6-year PA degree, however long you're with us, that scholarship is yours. Maintain a 2.5, and you've got no worries, really. We're going to open it up to questions pretty soon. I hope I didn't go too fast. But this is my contact information. Again, I'm Alan Bodwin, and you can reach me here. And I hope we have future conversations, and I hope we have time to answer questions. I'm all yours. And I'm going to pitch it back to StriveScan.
All right, looks like there is a question in the Q&A down there, Alan, if you want to take a look at it.
Yeah, sure. Does Massachusetts College? Yes, we do accept transfer students, and I'll type that in. We've actually been getting a lot of transfer students, and I'll be glad to work with you on that. Please, reach out to me. Let's have a conversation. Did you see I'm going to share my screen again. I'm going to go back here, and please copy that down and reach out to me. Let's have a conversation. Lately, we've been getting more and more transfer students, which is wonderful. Not a problem at all. And more people want to go into the health sciences, and there are not a lot of colleges and universities out there like us. There are solely a comprehensive healthcare universities that offer a wide range of the majors that are all nationally accredited. They're all where you have an Ivy League pretty much education through Harvard Medical, and you can take that and run with that and work in any state, and in some instances any country around the world. So absolutely, let's have a conversation. I would love to get that ball rolling, and I can put you in touch with our graduate and transfer folks and get that transition done pretty smoothly. And we've got some time, guys, so certainly it's very rare that you get me alone here like this. Normally I'm sharing space, and it's certainly, in pretty much at college fairs, there's crowds of people around us. So this is an awesome opportunity. Ask any questions, in getting on the transfer question again, yes, absolutely. But let's reach out for sure. Hopefully you got my contact information, and certainly let's have that conversation. Any other questions? Okay, we got another question in here. Is it pretty challenging to be accepted as a transfer student? No, not at all. I think that, and that's where we really want to have a conversation. Let's chat. Let's talk. I think the best thing to do is first getting you in touch with our transfer and graduate team. They're certainly going to look at your math and science courses biology and chemistry especially. But, certainly students, I have not seen have a challenging time getting in. I think what they like is that you're focused and serious. More so than you were. Some students aren't coming out of high school. Many are, but some aren't as sure what they want to do. And that's understandable. Certainly coming in the transfer aspect, you kind of know now what you want to do. It seems you want to go into healthcare, you want to go into nursing, you want to go into PA, you want to go into pharmacy. That conversation is not difficult at all. So please, absolutely, let's chat, and I'll get you geared in the right direction for sure. Not a problem. And now is a great time to go into healthcare. The job boom is coming again. Think about it. This school is 200 years old, pretty much. It's the oldest university in the city of Boston. It's that students are the highest income earning, students in the country, simply because the field we're focused in, it's the need. We fit that niche market that this is the need. We can live without a Louis Vuitton. We can live without a Tesla. We could live without a Ferrari Testarossa. We could live without a lot of things. You can't live without your health. You need that. And as long as that's going to be the case, then our students are always going to have opportunities. And this institution and university will be around for 3, 4, till the end of days. Hopefully there won't be, but it may be the last one standing because it focuses on that one important area. We got to have it. Can't live without it. We got another question. Yeah, I think, and that's a very good question. And what makes this school stand out from other specific pharmacy and health schools? And that's a great question, and it has a lot to do with our location at Harvard Medical School. A lot of our, let's just use pharmacy, for example, but this applies to nursing, PA, PT. The thing is, let's say, well, we'll just use pharmacy, for example. You're not, and this is okay, working in retail pharmacy at Walgreens and CVS, that's okay. But that's not what our students are limited to because of our location and the access our students have to the Harvard teaching hospitals. They're able to dive into areas within their field of pharmacy or nursing or et cetera, and HIV, cancer, diabetes, pediatric oncology, nuclear medicine, ambulatory care, drug and research development, diabetes, pediatric diabetes. I gave some examples earlier. That's what allowed Jamie from San Jose, the Silicon Valley area of California, to come here to Boston. He did research. He came back to California, easily landed a pediatric oncology pharmacy rotation at Stanford Medical, was in a position to turn down a job offer from Kaiser Permanente, which was like a couple $100,000, maybe 200 or 300, to take a residency at the University of Washington. Then if he wants to come back to Kaiser, he can ask for what he wants and he'll get it. Jenny went this year from the Huntington Beach area of Fountain Valley in pharmacy. She, in her freshman year as a pharm student, worked in the cardiac ICU at Mass General, Harvard Teaching Hospital. In her second year, she did stem cell research through the Dana-Farber Cancer Institute, another Harvard Teaching Hospital. She did the undergraduate research fellowship through Harvard Med, and in her senior year out of the Boston Children's Hospital, worked with a group of scientists and doctors to extract DNA to use to find cures for seizures and cancers. That landed her residency back in her home state of California, in Los Angeles, at the University of Southern California, aka USC, in oncology pharmacy, or emergency medicine pharmacy, excuse me. I think that's the biggest difference. You can't get that anywhere else. That just does, you gotta be here to get that. And when you have Harvard Medical on your resume and you have those experiences, doors will fly open for you left and right in any country and any state. Absolutely. That's why 98% of our kids pass their medical boards. 100% of them all get jobs. 80% that want to go to med school, vet school, and dental school or more do. And they're all reaching the highest success that there is simply because the experience they get with us. They can't get that anywhere else. Got to be in Boston for that. Remember, technology is Silicon Valley. Art and entertainment, Los Angeles and Broadway in New York City. Finance, Wall Street. I would say with the middle part of California's agriculture and the middle part of the country, of course, government, DC, medicine and healthcare and biomedical technology and all that, Boston, Cambridge. That's where that is. NASA in Southern California. We got a couple more questions. Have you ever known a student that studied pharmacy or anything related to health sciences and later in the future worked in FBI? You know, I don't know, but I wouldn't be surprised because the government is known for reaching out to specific folks that are experts in their field. That's very quite possible. I can't say that I ever have, but I would not be surprised if our students did. The government is always turning, especially in situations like now. You know, our graduates, before they graduated this year because of the coronavirus, were working before they graduated. Were offered high-paying jobs because the country needed them. They didn't wait. They plucked them right from the, if you kind of view us as apples dangling from the tree, they went right to our tree and offered great job opportunities and packages to our students, and our kids were off and running. It's what they wanted to do. And the government is always, especially in a time of need now, is turning to medical professionals for advice and support on how to handle things like this. So I wouldn't be surprised. Again, I can't say I've ever known, but I wouldn't be surprised if, being around 200 years, I'm sure somebody or a few have. Not surprised. Good question. Okay, so there was a question about Boston Cambridge School. I didn't necessarily emphasize a Boston Cambridge school. What I did was Cambridge and Boston are the mecca for biomedical and healthcare. Those are your meccas. The hospitals, the universities. You think about it, that's where the United States started when they won the war over our friends in Great Britain that many years ago. None of us were here, but when the independence was gained and America was born, and a lot of things started here in Boston, and the big thing was medicine, and that's continued. And you look at these Harvard teaching hospitals, they continuously get aid and donations and research funded, not just by the United States government, but other countries around the world. And our students are in the middle of that, and they're getting that experience. So it serves them well. Good question. And we got another one. Do you think this school is strongly superior to a school like UC Davis in terms of pharmacy, biomed? That's a very good question. It really depends on what you want to study. And I guess you got to look at it this way. I think in medicine and healthcare, it has to be because of our access to Harvard Medical and their research and teaching hospitals. UC Davis is a phenomenal school. No question about that. They don't have the Harvard teaching hospitals like we have. So I think that's where our students kind of get an edge over a lot of the competition. But by me saying that is in no means am I putting UC Davis down. They're a phenomenal school and they pump out phenomenal graduates each and every year. So it just really, I think if you want to dive a little bit deeper and gain more experience and have more unlimited resources, then with us, penetrating those Harvard teaching hospitals is going to give you that experience. Good question. Just checking the chat box. And another one. So only certain programs will get education from Harvard teaching hospitals, or will all programs and majors? Good question. The answer to that is all majors and programs. All of our students in all of our majors and programs are able to do internships and research through the Harvard teaching hospitals. They're also able to come back here and intern at Kaiser Permanente or any of the hospitals and healthcare organizations in California. Good question. What is the ED acceptance rate? By that, do you mean early action or early decision? We have early action, which is not binding, and the acceptance rate is pretty high. I would say, well, it changes from year to year depending on, most of our applicants apply early action. I don't know the specific number, but it's pretty good. I think earlier the better because we're a first come, first served school. So if you apply and you're admitted, and later a stronger applicant applies with a slightly higher GPA and academic profile, let's say that we've given out all our acceptances. Because you applied early and met the requirements, you're safe and sound. The later applicant that chose to apply later with the higher academic profile may want to have to go on the wait list because it's first come, first serve. So I definitely support early action, definitely, for that reason. Good question. I hope I answered it. Okay, question. You're welcome. My pleasure. You're welcome. Yeah, this is why we do this. This is what we're here for. We're here to help you, especially during these tough times. It's tough in a non-traditional college process, search process, but that's why StriveScan and the folks that run this program and the College2 out-of-state fairs, they're phenomenal, and we're all here for you guys. Absolutely. And our next question is, oh, you're very welcome. My pleasure. Miss Smith, pleasure. No problem. No problem. Yeah, it's different times for sure, but we'll get through it. We'll be okay, and hopefully soon we'll be able to go back to normal. But life is short, and we got to, as tough as things are, we've got to enjoy the time we have and do our best, and we are, and we'll get through it. It always turns out good in the end, right? It always works out, so, and it will. Okay, our next question is, do I recommend high schoolers to volunteer if it's safe to get hospital experience? Be very careful. It is a pandemic, so I'm never going to put pressure on students to do that. I don't recommend it. That's me. I don't know what other colleges are saying. I just want you to be very careful, and your health and safety comes first and foremost. We look at students holistically when we make our as we go through our admissions process. It's not just about high grades and high resumes. We look at a lot of different things, and certainly to put yourself in danger, be very, very careful right now. Even in non-COVID times, I don't require it because, certain states have age restrictions to when students can, some students coming through that are seniors aren't quite 18 or whatever the age may be in that state, and it varies. Which we would require them in order to get into a hospital and get experience. So I never require that. If during non-pandemic times, if you could, I'd encourage it, but I wouldn't put pressure on you because I know it's challenging and a lot of things are out of our control. But during this time, just be very careful. I wouldn't recommend it. It's your call, but have that conversation with your parents, your mom and dad, and your family, but just be very careful. I'm not expecting you to do that. So by all means, your safety and health come first for sure. We do have sports, and no problem. I mean, that's why we're here up until almost the end of the hour. We have sports, but it is at the club level, and that is because we don't ever want that to interfere. Let's say you're in a 6-year PharmD program, or you're in your nursing program, and your final year you have rotations, or you have rotations and internships and research throughout every year, and it's important. And maybe it's important as sports are, and they're important. And they may be important that night, but for the next 30 years of your life, you really got to be in that hospital doing that open heart surgery. We wouldn't want that sport to get in the way of that. So we offer it at the club level. You will play a tournament, a regular season. At the end, there'll be a tournament and playoffs and championship. And you'll compete with schools and students from MIT and Harvard and BU and BC and Tufts. But it's at the club level, and there's not going to be a lot of pressure on you to try and play, and you torn between a coach and your academics. We never wanted to put students in a situation like that. We don't try to alleviate stress. We don't want you to stress too much. So they're at the club level, and there are all of them. You have all the sports, and like I said, there's a season, there's a tournament, there's a championship, and it's this. Certainly you're going to get that experience. So again, it was just looking out for you and your health and well-being, and not trying to stress you out. But the answer is yes, at the club level. Next question, if you apply as a freshman and you don't get accepted, could you still go to a community college and transfer? Does that lessen your chances of getting in? Does it look bad? No, absolutely not. I would encourage you to apply because chances are you'll probably get admitted. But let's say you don't, and you have to go to a community college, and that's fine. And that will not look bad, and that won't lessen your chances. You'll be able to transfer in, do fine, and maintain above a 2.7 GPA to a 3.0 at a community college, and make sure you just get good grades in bio and chem, and you'll be fine. I would encourage you to apply and see what happens. And then even if for other reasons you have to go to a community college, we have history with you. We know who you are. Keep in touch with us. And then the transfer process will get even easier. So I think first apply, see what happens. But transferring in from a community college is not challenging at all. Not at all. Good question. Okay. Wait, we got some time. So I'm glad you're asking these questions. They're all important. Believe me, there's not a question that's not important, especially during times like this. It's challenging enough in non-pandemic times, and certainly the times we're going through now, it's very confusing, but we're here to help. That's what we're here for. And again, if you want to have a conversation and you're not feeling comfortable or confident about a certain grade, let's have that let's communicate offline. Let's have that conversation so it can get you in the right direction. Absolutely. Love the questions. Love that. Thank you. I missed that. That's the one thing that at a college fair we can look at each other and get those questions answered. And it's not quite the same, but hey, it's certainly at the end, the answer is all that counts, and you're getting the answers that you're looking for. So this has been a pleasure. Thank you. We still have some time, so ask away if you have any more questions. I live here in Pasadena, California with you guys, and back east, my colleague, it's 11:43 going on midnight out east. So they're in bed and we're still rocking and rolling out here. West Coast is where it's at. Are you the head of admissions? I did note your email and phone in case I ever have questions in the future. Although I am not the head of admissions, I'm one of the associate directors, and I make the decisions for all applicants in California. So certainly, if you do have questions, reach out to me, and that's why I encourage you to do so. I can help you more than you may think. I do read all the applications from California. I make all the decisions, but I'm not the director. He's a great guy. His name is Ricky Mott. He supports me and our efforts out here in California, and he knows and supports our California students who are some of our best students. These kids, so you guys come from out here, you go to Boston on a mission, and you come back and you're successful. You are. So whatever it is that you need, certainly let's touch base offline, and I'll be glad to help you and answer any questions you may have.
All right, that brings us just about to the end of our time. Alan, do you have any final comments before we say goodnight?
I just want to thank everybody, the students, any parents out there. You've been awesome. Thank you so much, Bob and Marie, for doing this and putting this on. Everything's been great. And hopefully tonight, certainly the audience out there learned a little bit more than they did before coming in. And I hope and I look forward to future chats with them offline, and then we can continue our conversations.
Great. Thank you so much for the presentation, and thanks to all of our attendees. When you close this window, there will be a link to a very quick 4-question survey. We'd appreciate any feedback you can provide. Also, this was just one of many sessions being hosted, so please be sure to sign up for additional sessions at college2careerfairsconnect.org. In about a week, you'll be able to find this session's recording as well as all the other session recordings at college2careerfairsconnect.org. Thanks again so much to everyone, and I hope you have a great night.
Have a good night, everybody. Thank you so much. It's been a pleasure.